Chronic pain. What is it? What can we do about it? In the course of my training and in the course of my practice, I've discovered really there are only 4 things that cause chronic pain. Let's take the example of pain in your index finger. There are only 4 reasons I might have pain in my index finger. Number 1, there's a problem with my index finger. Okay, so that's the second cause. It could be a problem inside the brain or in the spinal cord that is telling you, I've got pain in my index finger, even though there's nothing wrong with the index finger itself. Third possibility is a spine problem. Some of you out there who have pain in your index finger have discovered that, oh, I got a bulging disc. If it's not a problem with the index finger, if it's not a problem in the central nervous system and it's not a problem with the spine, well, what else could it be? Well, the only other thing it could be is that which connects the index finger to the spine. We call that the peripheral nervous system. That's the nervous system outside of the spinal cord and the brain. And that's what we do as peripheral nerve surgeons. We find out which nerve has the problem, and then we go and we address it. You could have nerve compression, which is just like what I described with carpal tunnel syndrome, where you have a nerve that's running through the hand or whatever other part of the body, and you got something else that's squeezing on it. And what do we do for carpal tunnel syndrome? We open up whatever it is that's squeezing on it, in this case a ligament, so that that nerve doesn't have anything pressing on it any longer. And guess what? The nerve starts working again. Meralgia paresthetica is a problem in which the nerve that's coming out of the pelvis near your hip is being squeezed on by a few structures there. And so what do? We make room for the nerve in that area, and those patients typically wake up without their pain. What would be an example of that? The most obvious example is what we call a neuroma. Okay, so a neuroma typically arises as a result of trauma. So you bang your leg against something, or you got stabbed, you got shot, you had some kind of trauma to the nerve, and in the process of healing, the nerve didn't heal correctly, and so it twists back on itself and forms this scar ball inside the nerve. This is basically wires getting crossed and your brain doing its best to interpret what that information means. And so how do we treat that? We take out the scar ball, and that's how you get rid of that pain. Those are the 2 basic things that we do as peripheral nerve surgeons to treat chronic pain. The great thing about it is that the surgeries that I do don't require narcotics. I haven't written a narcotic prescription in a year and a half, probably more. And I don't plan to write any more narcotic prescriptions. When we write prescriptions for narcotics, we're effectively creating addicts. And I'm not in favor of creating addicts. I'm in favor of finding solutions that fix the underlying problem, that get rid of the pain rather than just trying to manage it. And that's what we offer with peripheral nerve surgery. Permanent solutions to chronic pain.